and welcome to a new session about clinical pharmacology. Today we will continue talking about the antibacterials. We already covered an introduction to the antimicrobial drugs. Then we move to the classification. Then we move to the classification of antibacterials, and we have one session about already presented about penicillin and the category of penicillin. Today we are going to speak about cephalosporin and category, broad of spectrum, allergic reaction, therapeutic uses, contraindication. We cover all these sections. Okay, as a reminder here, you can see. Okay, as a reminder, here you have the site of action of antibiotic. The purpose of this slide to show you the location and action of cephalosporin on the bacterial cells. First of all, we need to remember cephalosporin belong to the beta-lactam group, and this group of antibiotic inhibits cell wall synthesis. So this is the site of action, inhibits cell wall synthesis. Okay, so inhibits cell wall synthesis will lead to you can see here the title, inhibits cell wall synthesis antibiotic. We have beta-lactam and we have others. So if you the question now will ask, cephalosporin belong to which of the following group of antibiotics? Cephalosporin belong to the beta-lactam, and beta-lactam belong to the cell wall inhibitor synthesis, cell wall synthesis inhibitor. So our topic today will focus on cephalosporin. So as you can see here, recording to the beta-lactam antibiotic, we have penicillin, it's covered in the first session, then our previous session, then we have cephalosporin, carbapenem, and monabactam. So for the cephalosporin, we have 5 generations. We need to remember that 5 generations belong to the cephalosporin. Okay, first generation cephalosporin, as you can see, first, second, third, and fourth, fifth generation. We need to remember the most important medication in each group. For example, here, as you can see, we have cefadroxil, cephalexin, cephalotin. This is a first generation cephalosporin. Then second generation, we have cefuroxim, cefprozil, cefaclor, cefotitan, cefoxitin, cefamandol. Regarding the third generation of cephalosporin, we have ceftriaxone, ceftazidime, cefotaxime, cefixime, cefdinir, cefpodoxime, cefixime. It's like repeated here, cefixime and cefixime. Okay, it's like repeated medication. And then we have ceftibutine. For fourth generation, we have one medication, cefibime. This is the fourth generation, one medication, and the fifth generation we have two, the most important recent one, and this in the market now, ceftaroline. So we are going to cover all these group of medication by speaking about the characteristic of each generation. Okay, we will start diving in and speaking about characteristic of these medication. When we talk about characteristic, in this case, we are going to speak about, we need to remember the mechanism of action. We need to remember uses. We need to speak about spectrum, and we need to speak about ADR, adverse drug reactions. We need to speak about CI, contraindication, or any other maybe important characteristic for this medication. Okay. Okay, so cephalosporin belong to the beta-lactam, as we mentioned before. Cephalosporin belong to the beta-lactam. Okay, belong to the beta-lactam group, closely related to the penicillin by closely related, very similar to the action of penicillin by the mechanism of action, by the development of resistance. So no need to go in details here. So if you need if we need to know how the cephalosporin work, we need to go back to the penicillin and look on the penicillin mechanism of action. and the mechanism of resistance also is like similar to the penicillin. Okay, so now this is the talk. This is an important takeaway point for the H generation. First generation cephalosporin, we are going to speak about two medication here. We have cefazolin and cephalexin. Cefazolin, this medication given to the patient like parenteral medication. When you say parenteral, that means we are speaking about injectable medication, and then we have cephalexin oral. So in this case, cefazolin will be given for example, operation, surgery, or acute infection. We have cephalexin for oral, like chronic infection and mild infection. This medication cover gram-positive cocci, some E. coli, and some Klebsiella pneumonia. So as you can see here, we need you to focus on this one here. So first generation mainly cover gram positive. So how many plus? If you type for this one, I will type 4 plus. Okay, so for first generation with the 4 plus for gram positive. If you speak about gram negative, I will type here 1 plus. So mainly the first generation mainly cover the gram positive cocci, such as the staphylococci, streptococci, E. coli, Klebsiella. Clinical use, this medication used during surgery as a surgical prophylaxis process. This medication is not present highly activity against the gram-negative cocci. So as you can see here, one plus only when you talk about gram-negative. So this group of medication, again, effective against the gram-positive cocci. Example, cefazolin and cephalexin. Okay, here I'm sharing the screen with you from the Google image to show you what we have regarding the cephalexin. So cephalexin belongs to the first generation, mainly cover gram-positive bacteria, minimum effect on the gram-negative bacteria. And one example from this group of medication, cephalexin, as you can see here, available capsule, and sometimes you can see it like suspension, oral suspension. If you click on the oral suspension here, oral suspension could be available for children and for kids, for infant, for example. This is for cephalexin, oral, first generation. Moving to the first generation injectable, you can see here we have cefazolin. Cefazolin, we have it here. We have another one here. So cefazolin injection, we have it as vial there. Okay, so I will move this one from here back to our back to our slides. Okay, we're done with the first generation cefazolin, cephalexin, where we have some words about cefazolin later on in the slide to summarize the cephalosporin. We need you to remember that. The second generation cephalosporin, to speak about second generation, we have list of medications. Cefaclor, one of the most important medications, cefuroxime, cefprozil, cefotitan, cefoxitin. Cefaclor, cefuroxime, this medication become less active against the gram-negative organism, gram-negative cocci, and become more active against the gram-negative organism. So if you type here G plus gram-positive bacteria, this is kind of 2 plus. What about the gram-negative bacteria? What about the gram-negative bacteria? This will be like 3 or 4 plus. So as you can see here, we're moving from the gram-positive to the gram-negative. So the question now, which of the following bacteria will be covered by the second generation cephalosporin? This one will be maybe tend towards the maybe eliminate or treatment of gram-negative bacteria more than gram-positive bacteria. So extend efficacy against the gram-negative organism. And could be cover some anaerobic bacteria. Anaerobic bacteria such as bacteroid fragiles and some Haemophilus influenza could be covered in this process. Okay, the third generation, one of the most important group of medication, third generation cephalosporin. As you can see here, we have ceftazidime, cefotaxime, cefixime, ceftriaxone. The only one available oral here in this group, cefixime. So the only one in third generation available oral, cefixime, this one here. What else? This group of medication able, the injectable one, able to penetrate blood-brain barrier, cross blood-brain barrier, except the cefixime. So the question: which of the following cephalosporin able to penetrate and are cross blood-brain barrier? We have ceftriaxone, blood-brain barrier. We have ceftazidime, for example, blood-brain barrier, cefotaxime, cross-blood-brain barrier. So the most important advantage for the third generation cephalosporin, we need you to remember that this medication able to cross blood-brain barrier, with the exception of cefixime, that's given orally. Ceftriaxone, as you can see, prescribed parenteral, injectable, and cefixime orally. Drug of choice for gonorrhea. So drug of choice for gonorrhea, number one. And this medication also drug of choice for some specific bacteria, such as specific cases such as meningitis. Okay, so speaking a little bit about some specific characteristic for each antibiotic, we need to remember a group of medication. We have ceftazidime. Ceftazidime has activity against the Pseudomonas aeruginosa, ceftazidime. Then we have ceftriaxone, active against bacteroid, flagile, anaerobe bacteria. So this important here. We are speaking about the group of medication here, okay? And ceftriaxone effective against gonorrhea. What else? Meningitis. Okay, important characteristic for ceftriaxone: no dosage adjustment needed or necessary in patient with renal or hepatic dysfunction. So if the patients are from hepatic or renal dysfunction, this is a drug of choice. We go with a ceftriaxone. Ceftriaxone advantage: no need to adjust the dose in patient with a renal or hepatic dysfunction. Okay, third generation again. We talk about here. We are trying to focus on the clinical use of ceftriaxone. Normally, we prescribe it like single injection. You can see here we have single injection of ceftriaxone. Could be IM, could be IV. A single injection for patients who are from gonococcal infection, gonorrhea, gonococcal infection. If the patients are from acute otitis media, as you can see here, we can prescribe ceftriaxone one injection it's able to cure and recover from acute otitis media. If you compare that with amoxicillin, we need 10 days treatment. So this medication, ceftriaxone, single injection, is able to cure and recover from acute otitis media, comparable with the 10 days of treatment of amoxicillin. Again, another one, the ceftriaxone could be prescribed IV prior surgery as a surgical prophylaxis before surgery, and is recommended for this process here to prevent from the infections around surgery, before, during, or after surgery. Ceftriaxone, as you can see, is used for treatment of meningitis. That's great. And meningitis is considered like life-threatening infections. Patient will die from this infection if it's not treated properly. They said in this case, ceftriaxone should be prescribed for 1 to 2 weeks, because this we have life-threatening infection here. So as you can see here, the first three cases we focus on single injection for gonorrhea, for acute otitis media, for surgical prophylaxis. But for meningitis, life-threatening infection, we need 7 to maybe 14 days of treatment. Here I'm sharing the screen from Google Images to show you the ceftriaxone vials available in the market. So if we click, for example, on one of these medication, we have it there. So ceftriaxone for injection. Another one here. Okay, you can see ceftriaxone injection, IM, IV. For IM, intramuscular, IV for intravenous use. Okay, so we need to again to remember the clinical use: gonorrhea, Gonorrhea number, very important group of treatment. Gonorrhea, otitis media, prophylaxis surgery, and meningitis. And we have the leaflet here. You can click on this link and read more information. Okay. Okay, moving to the fourth generation cephalosporin, we have only CVBeam. CVBeam considered like fourth generation. What is the advantages? I will go back a little bit to show you what we have for the third generation. Again, for third generation, we need to emphasize on some important issue. So the third generation, they said increase activity against the gram-negative bacteria. Against a gram-negative bacteria. That means if you say a gram-negative bacteria, how many plus we have there? They said you can type it like 4 or 6 plus. A gram-negative bacteria, and maybe it's become less effective against gram-positive bacteria, like 1 or 2 plus. So in this case, we can see here third generation, it's like increased activity, has a maximum activity against the gram-negative bacteria. Okay. For the fourth generation cephalosporin, the fourth generation, we have only one medication, CVBeam, and this effective against the gram-negative bacteria plus the gram-positive bacteria. So cover both of them, gram-positive plus gram-negative bacteria. This is a broad spectrum for the fourth generation, and we have one medication, CVBeam. Okay, and this medication effective against the maybe bacteria that produce beta-lactamase. The clinical use, this medication considered like broad spectrum antibiotic, cover a broad range of infections caused by gram-negative or gram-positive bacteria. CVB. Okay, CVBeam prescribe IM or IV. As you can see here, you can see the CVBeam injection vials, 1 gram, 2 gram per vials. CVBeam injection indicated for the treatment of pneumonia. Empiric therapy for patients from febrile or febrile neutropenic patients. So if the patient comes to the clinic with fever and we don't know exactly what type of infection, gram positive, gram negative, anaerobic bacteria, we go this CVBeam as a fourth generation, but not the first choice. Uncomplicated or complicated urinary tract infections, okay, this will be great. Urinary tract infection, again, this is not the first choice. So the first choice could be like fluoroquinolone, ciprofloxacin. Uncomplicated skin and skin structure infections, again, this is an important one. Complicated abdominal infections, complicated intra-abdominal infection used in combination with the metronidazole. And the purpose of metronidazole to cover the anaerobic bacteria. So CVBeam IM IV used for pneumonia, empiric therapy, urinary tract infections, skin infections, complicated and uncomplicated skin infections or urinary tract infections, intra-abdominal infections in combination with the metronidazole. Available IV and IM. As you can see it here, we can prescribe it to the patient, IV or IM. Okay, fifth generation cephalosporin here. Fifth generation, I'm going to only focus on one medication. We have ceftaroline. Ceftaroline has activity in the bacteria caused by the MRSA, methicillin resistant Staphylococcus aureus. Ceftaroline used mainly for the infection caused by MRSA. We use it for the skin infection or community acquired bacterial pneumonia. So we use it for pneumonia or for skin infections, especially when we have acute bacterial skin infections, ABSSSI, so acute bacterial skin and skin structure infections, and we can use it for pneumonia, community acquired bacterial pneumonia with a gap there. So please remember, for fifth generation, use it mainly for MRSA, ceftaroline. So I have a question. Which of these, what type of penicillin we can use it for patients suffer from MSSA? Methicillin sensitivity Staphylococcus aureus. What type of medication are going to use? So when you have Staphylococcus aureus, the medication will be For example, we can go with the cloxacillin or methicillin. Okay, if the patient, if the bacteria start resist MR, become like MRSA, we can maybe choose vancomycin. Okay, if the bacteria resists vancomycin SA, if the bacteria resists vancomycin, we can use linezolid. If the bacteria resists linezolid, we can use ceftriaxone. So as you can see here, we have options: cloxacillin, methicillin. If the bacteria resists vancomycin, if the bacteria resists linezolid, if the bacteria resists ceftriaxone, and we have a list of bacteria list of antibiotic could be used to treat MRSA. Okay, again, so this is a fifth generation. Okay, takeaway point. This is summary from the cephalosporin. As you can see here, we are going to speak like takeaway points, focus point, important point for us. First generation cefazolin. What is cefazolin? Cefazolin belong to the first generation cephalosporin. Cefazolin available like injectable medication, long acting, long duration of action, when will penetrate to the bone. For this reason, we use it for the orthopedic surgery or orthopedic infections. Please remember this one. Which of the following cephalosporin has a good penetration to the bone used in the orthopedic surgery and infections? We have cefazolin. Cephalexin prototype of third generation. Cephalexin oral, prescribed twice daily and could be prescribed for patients from pharyngitis. Second generation cephalosporin, we have cefuroxime sodium, cefuroxime exetyl or exetyl. Cefuroxime sodium is considered like a prototype. Second generation cefuroxime sodium injectable medication, long duration, long half-life, cross blood-brain barrier, could be used for bronchitis and pneumonia. On the other hand, we have cefuroxime exetyl. We have this group of medication prescribed orally twice daily, and it's active against the gram against beta bacteria that produce beta-lactamase enzyme. Here I'm sharing the screen from Google Image to show you we have cefuroxime sodium, and this is available injectable. So what we have here, if you click on one of these, you can read the cefuroxime. It's like powder for injection, cefuroxime, and we have it here again, cefuroxime sodium. What about other group of medication? I will show you cefuroxime exetyl. Okay, cefuroxime exetyl available tablets, and this belong to the second generation cephalosporin. So you can see it available like tablets. Okay, so for the second generation, we need you to remember this group: cefuroxime sodium cefuroxime or cefuroxime sodium prototype, second generation, injectable and long duration of action, close blood-brain barrier. Cefuroxime exetyl oral, twice daily, and it's active against the beta-lactamase bacterial. What about the takeaway point from the third and fourth generation? Third generation, we have oral. We have two medication orally, two medication, cefdinir and cefixime. Moving to the third generation, injectable third medication. We need you to remember the ceftriaxone and ceftazidime. Ceftriaxone longer half-life, one dose per day, achieve high blood concentration and high cerebral spinal fluid concentration. We can prescribe it for patients from gonorrhea, one injection, single injection, or drug of choice for meningitis. But remember, here we use it for 7 to 14 days of treatment for meningitis. So we can use it for the gonorrhea, acute otitis media, meningitis. Okay, moving to the fourth generation cephalosporin, we have CVB, mainly covers the Pseudomonas aeruginosa effective, and the fifth generation cephalosporin, we have ceftriaxone, active against MRSA or MRSA. Okay, I'm sharing the screen from Google Image again to show you what we have here for the fourth generation CV beam available like vial for injection. And this is a fourth generation, and this is mainly cover the Pseudomonas aeruginosa. Okay, you remember that CV beam active against the Pseudomonas aeruginosa. What about ceftaroline? Ceftaroline active against the MRSA, ceftaroline, and we have the images for ceftaroline here. So you can see the ceftaroline, teflaro. We have teflaro here, ceftaroline for injection. Okay. Okay, now we start talking about some characteristic or properties of each group of individual medication. You can see here we have cefazoline. Cefazoline used for prophylaxis before prior surgery because it has long half-life and it's active against penicillinase producing Staphylococcus aureus and able to penetrate bone in a good manner, and for this reason we use it in orthopedic surgery. So the question, which of these cephalosporin used for during orthopedic surgery as a prophylaxis strategy? We have cefazoline. This medication may be eliminated through the kidney, through the tubular secretion and glomerular filtration. Dose must be adjusted for this patient if the patient suffers from renal failure or severe renal failure, and you need to adjust the dose. We have some exceptions there. They try to remind us with the cefobirazone and ceftriaxone. This group of medication mainly eliminated through the bile into the feces, and no need to adjust the dose in patient with renal insufficiency. So the question, which of these cephalosporin can be prescribed safely to the patient suffer from renal dysfunction or renal insufficiency? We have ceftriaxone and cefobirazone. Okay, moving to the last slide about cephalosporin, we have allergic manifestation. Here, patient who have anaphylactic response towards penicillin. If the patient come to the clinic and he has history of severe allergic anaphylactic reactions, here the using of cephalosporin considered like contraindication. We don't prescribe cephalosporin to the patient suffer from history of severe allergic to the penicillin. So I will repeat it: patient who have had a history of anaphylactic response such as Stevens-Johnson syndrome or toxic epidermal necrolysis to the penicillin should not receive cephalosporin. Okay, this is number one. Number two, the patient should be avoided or use it with caution in individual allergic to the penicillin. And I'm going to present some data there or some images also. They found we have cross reactivity between penicillin and cephalosporin about 3% to 5%. Here what we can do for the patient. Okay, so let me do something here to. Okay, so here we have some cases of Stevens-Johnson syndrome, and this one could be severe. As you can see here, Stevens-Johnson is coming like severe burn for the patients may suffer from Stevens-Johnson. Again, the like severe skin rash and could be life-threatening for Stevens-Johnson. Okay, so this one, if the patient suffers from anaphylactic shock, Stevens-Johnson, we don't recommend to use penicillin. But if the patient has history of like skin rash, for example, like this one here, I will show you what one of these, for example, from Google Image. For example, the patient come to the clinic and he has a skin rash like this one here. You can see here we have skin rash for the maybe child suffer from allergic skin rash. In this case here, if the patient suffer from skin rash and due to the allergy towards penicillin, we recommend to avoid using cephalosporin or use cephalosporin with the caution under monitoring. Okay, the reason we have 3 to 5% suffer from cross allergic reaction between penicillin and cephalosporin. Okay. Okay, will we finish our cephalosporin, and We discussed a group of medication according to the generation: first, second, third, fourth, and fifth generation. We talked or spoke about the antibacterial spectrum, speaking about the gram negative, gram positive, which of these are cephalosporin active against Pseudomonas, which of them active towards MRSA, which of these bacteria active against bacteroid, anaerobic, and we have some medication could be combined with the metronidazole to treat patients suffer from intra-abdominal infections. We also cover the allergic reactions. If the patient suffers from severe allergy to the penicillin, we don't recommend it to use cephalosporin. If the patient suffers only from minor skin allergy towards penicillin, we can use cephalosporin with caution. At this point, we conclude our lecture, and I would like to thank everyone for listening and watching this series of antibiotic, and see you soon in next session when we talk when try to complete the topics about beta lactam and cell wall synthesis inhibitor. Thank you so much and have a great day, everyone.